The Kaiser Family Foundation presents Health08.org, election news, analysis, and events.
Senator McCain, thanks for joining us on Health08.org.
Thank you, Jackie.
You recently announced your health care plan, and the three big pieces of it are giving Americans more choice in health insurance, linking payment to quality care, and the notion of personal responsibility. The overarching goal is to control costs. As you know, some of the other candidates have focused instead on the uninsured. So I'm wondering if you can walk us through how you made that choice, or if it even was considered a choice, between costs and the uninsured.
Well, Jackie, I think that if you want to give the American people straight talk, Medicare's going broke. On the front page of USA Today last week, the headline was Medicaid costs skyrocket. Over 10% inflation associated with Medicaid in 1 year. That is not sustainable for any program. And so I think it's important for us to point out that the highest quality health care in the world is here in the United States of America. The problem is it's not affordable, therefore not available. So it seems to me that the more you lower costs, the more you get costs under control, the more likely you are to encompass more and more of the uninsured. Why is the uninsured up to 47 million from 30-some million just a couple of years ago? Is because of the affordability aspect of it, not because of the quality side of it. So I think you've got to keep costs down, and as you mentioned in your just a second ago, that we have to concentrate on that aspect of it if we're ever going to save the system, which is going broke. A little straight talk.
Can I ask you a hypothetical, and that is, if you're elected, and if the main points of this program are enacted, what do you think the number of the uninsured looks like after a first term?
Well, I would hope that it would be very low if we can keep costs down. You're going to be fighting very large bureaucracies. You're going to be fighting very big special interests that like the status quo. You're going to be fighting the pharmaceutical companies who don't want transparency. I was just out in Iowa and in South Carolina, strangely enough, and both attorneys generals of both of those states are suing the pharmaceutical companies because of the charges for pharmaceuticals associated with Medicaid, and because there's no transparency. So we'll be taking on a lot of the special interests, but I am convinced if we have wellness and fitness, if we have more choices, if we give the individual more responsibility, then I think you will see costs level off, and then therefore we'll have more and more available insurance. And finally, by giving each individual a tax credit of $2,500 or family of $5,000, then I think we'll give them more choices, and they'll be more responsible as to how they invest that money in order to get affordable and available health insurance.
What families would qualify?
Every family in America.
Every single family?
Every family in America would get a $5,000 for refundable tax credit. For the
even if a family has employer-covered insurance?
Yes, even if they have it. And I think it's important, again, because if they don't use it for health insurance, then they could invest it in health savings accounts.
You alluded a moment ago to the big challenges facing whoever gets into the White House. And one of the questions you posed in your speech a few weeks ago was, in our haste, will we promise more than we can deliver? And I guess I have to ask you that question. Do you worry about promising more than you can deliver because of the great obstacles to getting Congress and the White House to work together on big changes like this? And the special interests you mentioned.
I believe that the American people, when told the truth, will always rise to the occasion. How many young Americans today do you think know that there will be no Medicare, Medicaid for them when they reach retirement age if they reach it after the year 2019? We've got to tell them the truth, and we've got to tell them what needs to be done, and I think we can do that. And I think the present generation of retirees will feel that same obligation to future generations, but they've got to be told the facts.
And so do you count on the involvement, concern of the public to help you break these traditional political log jams?
It has to be. It has to be. The Medicare Part D bill was an $800 billion to $1 trillion unfunded liability piled on top of another about $30 trillion, according to David Walker, the head of the Government Accountability Office, unfunded liability associated with Medicare. I wonder how many Americans knew that. And the pharmaceutical companies got enormous advantages in that, which I think are going to drive costs up. We should be able to re-import drugs from Canada. We should have the pharmaceutical companies compete against each other to provide these prescription drugs for needy seniors. And finally, why should we pass a law that pays for my prescription drugs? I vote myself pay raises all the time. Don't you think I could pay for mine? The original intent was that to take care of low-income seniors above the poverty line, as you know, but not all seniors.
Was there ever a time in your life, Senator, where you or someone close to you couldn't afford medical care or medicine that was needed? And if so, did that drive you to the point where you are now in terms of laying out this policy?
I don't think anyone in my family, frankly, most of my family has been in the military, including my sons. So, and there's health care there. But I certainly have known lots of people who either can't get health insurance because pre-existing conditions or chronic disease. I have known many people who have basically had their savings evaporate because of experiencing a catastrophic illness. So I certainly have known a lot of people, but nobody in my family.
Okay. Let me ask you a question apart from your plan, and that is the issue of national preparedness for public health emergencies of the sort that we saw in New Orleans when Katrina swept through. There are reports that suggest the country isn't where it needs to be. What would you do to change that as president?
One of the things I would do, believe it or not, is that I would contract with some private enterprises that deliver these kinds of services all the time. FedEx and UPS know where a package is every moment of the day or night. Walmart and Home Depot and other organizations are used to distributing and providing goods and services. I think we ought to enter into contract with medical care providers, with people who can deliver pharmaceuticals and much needed assistance, and just call on them rather than us stockpile billions of dollars of equipment and medical supplies someplace that may end up as ICE did in Maine during Katrina. We ought to utilize the efficiencies of the private sector, in other words.
Okay. And a final question, and that has to do with HIV/AIDS. As you know, it remains a problem in the United States, particularly in the South, particularly for African Americans. What's your policy on that? More funding? What's the answer?
I'd be glad to devote more funding. It's such a horrible disease. But I think education and awareness is clearly the key to it. Better lifestyles, better economic conditions, better abstinence is obviously something that I strongly believe in. But I think that the only way you're really going to solve this problem is to, one, to make people aware of the dangers of AIDS, and two, economic progress in America. I know that sounds like a big issue, but when you look at the economic level of most Americans who are afflicted with AIDS, it's because they're mired, frankly, in poverty without an opportunity to improve their lives. And that's the overriding issue, but certainly I believe in ABC, and we could probably do a much better job in public education than we do today.
Thank you very much, Senator John McCain. Thank you.
The Kaiser Family Foundation presents health08.org, election news, analysis, and events.